Dr. Mom. All
Hello.
right. So
Hello.
you
Sorry that this is quite late. I didn't know how to make it work.
okay? Dr. Fab, I really appreciate your accepting our invitation. How is Melbourne this evening?
Yeah, here it's 11 p.m. It's
Okay.
11 p.m. at the moment, so I'm ready to go to the bed.
Okay. I know it's very late, almost 12 midnight, and I'm sorry to have been taking your time. It was quite disturbing. My network was not really good, and the good people of Anatomical Student Society of Nigeria, we are sending our greetings, sir. And I'll just quickly drop Dr. Fab's profile. Dr. Fab is he has worked in different Ivy and a lecturer of Monash University. I hope we can see it on the screen. Okay, so Dr. Fab, because I have taken much of your time, all my questions, I don't think you'll be able to answer them, but we'll go with just one question and we will call it a day. Hopefully, when we have more of these sections, we'll have you back on board.
No worries, all good.
It was very funny when you said, Jemima, will this give you a scholarship? I was like, Dr. Fab, please, they want to hear your Okay, let me go straight to the question because of time.
That's fine.
As a clinical embryologist, I think I was running a wrong profile. Okay, yes. As a clinical embryologist that practiced for over 12 years, and with your experience in the IVF clinic, with practice of embryology and so on, can you just share with us what is so fascinating about your experience that will motivate us? Because there's an anatomy that is called embryology, which I know you are familiar with, and I know some persons here are aspiring to be a prospective embryologist like myself. So I would love to hear you your what is fascinating about your experience, sir.
Yeah, sure. So can you listen me clearly? Yeah.
Yeah, we can.
Okay. So, well, just to answer your question, yeah, you're right. I think my interest in embryology started actually when I was doing my studies, my bachelor, when I was studying embryology as part of anatomy as well. And during that time, when I got to learn about the development, the human development, I really find it really fascinated, and I thought that it was a field uh, like what I will be ended up doing. But then I start one day in doing some lab work in like practicing how to study cells. Uh, I got to learn how we analyze sperm cells, and then I got to know that was people working in clinical embryology. And clinical embryology, just to introduce everybody that is not too familiar with, is basically a field where scientists and clinicians work together to help couples to get pregnant and become parents. And we basically help in the lab to basically we help to produce embryos, human embryos, to then put them back into humans, and then the couples can become parents. So I don't know if that answered your question.
Okay, so sir, you said embryology is the practice where you help those that cannot conceive artificially. Okay, so sir, you just defined embryology and you just give us a brief insight. We would like to know what is fascinating about, why should we pursue that area, and why do you think that it's something encouraging that you come out every day, you go to the Monash clinic, helping patients? What's so fascinating about that?
Uh, well, thank you for that question. Well, yeah, embryology, I think, is one field very good to develop a career, because um, first you see science with your eyes. So you can really see science with your eyes, and at the same time see how you can help people to basically come make their dreams come true. That is becoming parents. So it's a field that definitely can make you feel full, and get joy through it. And also, in my side, from the research perspective, is really interesting as well, because we have a lot to do. There is so much to do to improve uh, the technology and the treatments that we perform. And yeah, that is something I could say. So then, to also to maybe help a little bit the people that could be interested, like students in Nigeria, um, in order to work in clinical embryology, is very specific field. So it's normally required that you have to conduct very specialized studies. Normally, that involves either starting by doing research. It could be master degrees or PhD. uh, but in some countries, like Australia, like here,
Yeah.
we have a specific master degrees, and courses that it could help you to actually work in the field of clinical embryology. We have a course that uh, we run here, that is one of the world's most famous courses in clinical embryology. Uh, and we have had the students for all over the world. uh, and we teach basically hands-on practical skills to then become a clinical embryologist. So yeah, all the best. I would say, if for the people that would like to study. In your case, if you are interested in clinical embryology, that would be great. It would be great to have someone from Nigeria. I think we haven't got a student from Nigeria. I'm not sure. I don't think so. But we have students from Africa, though, from different countries. Uh, and I will have to check, actually. But yeah, uh, we look forward to receive students that are really passionate and about what they do, and yep, that I could say.
Okay, sir, thank you very much. For so I can see you. I'll close my teeth, but I have heard a lot from what Dr. Fabrizzio has said. Um, Dr. Fabshire, I got the pronunciation of your name because I've been learning pronunciation for like 2 days.
That's fine. That's fine. All good. It's all good.
Dr. Fabrizio, um, we we learned a lot from what you said. You have said embryology is an aspect of anatomy that helps those that cannot conceive to conceive artificially. And you've also said it is something that we should develop interest in because it makes, will I say, infertile couple to be happy, and you provide a means to help those that cannot also conceive. You've also said you'll be loving to see some Nigerian students come around to have their postgraduate studies at Monash University. As the lecturer there, it's not guaranteed anybody, it's only saying hardworking students. So actually, that's what you said, Dr. Fab.
Thank you very much. And yeah, and we would love to have some students from Nigeria.
Okay. Okay. Okay, sir. Thank you very much. It is 1:10 by my time, and I think it is 11:45 p.m. by your time, sir. Okay, sir.
Yes. Okay. Take care.
Bye
Bye
bye.
bye.
Thank you very much for having us.